The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Welcome to Bobo 89.1. You're listening to Healthcare Today with the HSA, the Cayman Islands Authority on all things health. I'm your host, Chuck Taylor, and I have today with me some wonderful, intelligent, knowledgeable young ladies that's going to help me understand exactly how HSA is doing today. Now, we're going to talk a little bit about this summer student internship program. I have Miss Raquel here.
Hi.
And I have also Miss Monique.
Hi, Chuck.
Hello, ladies. I just want to say, first of all, thank you so much for stopping by here today. And this is from each and every Friday and Saturday from 1 till 2 p.m. It's Healthcare Today with the HSA. You'll be hearing about programs. You'll hear about new things that they're doing. And most of all, it'll be all about you. Things that can make your life better, make your life easier, because that's what they're here for. The HSA is here to make your life better. Am I correct in that statement?
Absolutely, 100%. Very pleased for the opportunity to be here.
Thank you so much. So we'll dive right into the summer internship program. Now, this is an internship program that has been going on. Tell me a little bit about it.
All right. So over the past few years, and when I say past few years, we've really formalized and grown and restructured this program quite a bit. Unfortunately, due to COVID restraints, we have had to tweak the last 2 years. 2020, we weren't able to offer it. Last year, we took fewer students than we typically would take. But it is such a wonderful opportunity for students to be able to get an opportunity to firsthand have working experience in the healthcare industry. And as we go on through this program, we'll talk about a little bit more about, when I say healthcare, what that means as it relates to work experience at HSA specifically, because we hear healthcare and we think, yep, doctors and nurses, and if I don't want to be any of those things, then this is not for me. But we'll talk so much more as as the conversation goes on about what else we offer, and it's very, very exciting.
It is a working organization. It's just not doctors, nurses, and the hospital. There is an organization here.
Yeah, definitely not, because there's so many other fields such as human resources, information technology, there are biomed engineers. So we definitely touch on the other career opportunities available at the HSA or in healthcare in general.
Excellent, excellent. So let's just toss it out there. It's been around for many years. You guys probably receive about how much applicants on average?
Well, applications, they can vary. Give or take, most times about 100 students at a time. And this really depends on availability of our departments and managers to be able to accommodate them in any given summer. But I mean, our managers are so on board. They are happy. I sent out an email saying, hey, managers, get back to me and let me know how many students you can take. And within 5 minutes, I started getting responses going, I'll have 2 and I'll have 1 and I'll have, because they really, really want to expose our young Caymanians to the opportunities that there are within healthcare. And we'll talk, like Monique was saying, it's so much more than our doctors and nurses. I'm surprised she didn't mention marketing and communication.
Yeah, right.
But
yes, we definitely need more marketers, more PR officers. Photography is a part of our
and graphics,
rules.
Graphic
Designers, definitely.
It's one of the things that one of the more recent ones that we've been expanding on, because we realize that their team, I say that they're small, but they're mighty. There is so much that they do. And as we want to transition and shift, even as we're going into the 21st century and getting more into the technological age, their department has been doing so much more. And so now they're actually teasing out some of the key responsibilities even within that department, adding graphic designers and adding persons who are in communication and adding all these different things that are vital. Yeah, absolutely.
It's so much quicker to have it in-house to get it done. So you could just walk down the hall, say, hey, I need this design. Here's an idea. And somebody can put that together.
Absolutely.
Yeah. And with an organization of 900 staff, and
wait, hold, how many?
Actually, we're at over 1,100 at the moment.
Wow. Okay, there you go. Raquel is the age.
No. We've definitely grown, and a lot of our students transition into roles. And one of the things that we've been doing recently, and we're continuing to explore how we can do it with even more roles, but we've been looking at the ones that are, what are our entry-level roles? How do we reserve them for our Caymanian? And when I say Caymanian, all of our roles are primarily geared towards Caymanians, but I'm talking about out of high school Caymanians, the ones who may say, hey, you know what, the degree isn't for me or the certification isn't for me, but I'll go to trade school or I'll get a certification or I'll do whatever upskilling it takes to come into an entry-level role. And while we will still expect you to grow once you've come in, there's so many students who leave high school and maybe they don't have the capacity or it's not the right timing for them to go straight into tertiary education. We now have started looking at how do we make these entry-level posts easier for them to come in from an experiential standpoint, get that experience, then add the certifications and qualifications in addition to the experience.
So let's just say this is my last year at high school and I'm thinking about going into XYZ field.
Yeah.
Don't think I'm prepared for it yet. And I see this. How long does the internship tell me a little bit of how it commences, how it starts, how it ends, and how long is it?
I'll use our pharmacy assistant position as an example. A lot of our interns will come in and say, hey, I want to go into pharmacy. They go in as work experience. They stay on. And when I say stay on, it's not automatic. Obviously, you go through the recruitment process, but, they usually have what is necessary, including the desire. They go through the recruitment process. They come in as a pharmacy assistant. And then the manager there will start to motivate them, help them grow and develop, put them into a training program. And then all of a sudden, in a couple of years, they're a tech.
Right.
And so those are the kind of opportunities we're creating. We have a biomed department, and we've actually split the role. So we now have what we refer to as a junior biomedical technician.
And see, this is one of the things I think is so important for us as a community to understand. Kids now are smarter. You're talking 15, 16-year-olds that understand job and work ethics. So get them started on that.
Yeah. And they can learn some of those things. I mean, really, we say, hey, if you're coming with the enthusiasm and the willingness to learn and wanting to put in the work, there's room for growth. There is absolutely room for growth.
So tell me one of the key factors that you look at in applications for the career in the healthcare industry.
If we're looking at, and why I can't say in the career industry, because we have so many different pathways, right? I mean, we are an extensive organization. We exist in at least 5 clinics in terms of our 5 districts. Plus, we have other locations. We have our Faith Hospital in Cayman, Little Cayman Clinic. So even persons who, we have some persons whose family is in Cayman and they want to go back there. When we look at career pathways, it's so extensive that we wouldn't be able to speak on that specifically. But when it comes to the internship program, well, I mean, the first that we tend to look at is obviously our Caymanians first, right? We're going to consider possibly some of the other applications if we feel like, okay, we have 100 places or we have 50 places and maybe we only have 20 applications. And that never happens, by the way. So if you're interested, you got to get those applications in. But we definitely want to make sure that our students who are likely to remain here or even go off and come back here have something to come back to. So we definitely want to make sure we're offering first and foremost those positions to our Caymanian students. Now, when we say students, we're talking about from high school to college to university. But if you're a high school student, we do want to ensure that you are no younger than, at the time that you're going to start your placement, 16 years of age. Because that's going to be important. We have to understand that we're putting you in real world situations. And even if you're in a non-clinical department, you still are going to be in healthcare And so we want to make sure that you are at least of a mature age.
That's
And
understandable.
students mature a lot younger, but we have to make sure that we at least have a standard that we feel like these students at this age are very close to leaving high school and maybe more equipped to be able to take on the demand of maybe a 9 to 5, the demand of long days and,
Understandable.
multitasking, these kind of things.
Correct. Like the individual placements, what's the varying time on those?
We are offering anything from 4 to 8 weeks. It really depends on the age of the student. So our high school students, I mean, again, they start. This may be their very first experience, and we don't want to overwhelm them. So having them commit their entire summer can sometimes be daunting. It can feel like a bit much. After they make it through the first week, you'll find they sleep a lot more. They're like, oh man, waking up early. And even though they do that for school, but having longer days, they might feel a little more challenged. And so we may offer a 4-week placement to sort of our high school students, possibly 6 weeks if they can handle it, because some of them are coming back to us each year, right? But then when we get to university level, where someone might be in their, maybe they might be in a bachelor's program in their second, third, or year student who's about to graduate, and they really want this event to add to their resume. So when they do graduate, those are the students we really are going to start offering 8-week placements to. We want them to have more in-depth experience. Because when you think about the working world, if you are the new employee, after the first 2, 3, 4 weeks is when you're just finding your footing, knowing where everything is, knowing what your responsibilities are, and then boom, your placement's done.
Right.
So that's why we're wanting to offer 8 weeks.
Give a little bit more time for them to
absolutely.
settle in and understand it also.
And then after understanding it and feeling more confident and even capable, then you have the real experience happening then, right? And so that's why we want to offer those older students a little bit more time.
So how would I go about applying for this now? Because we found out the age, the requirements. When does the application process open and how long is it for?
The application process, it opens actually April 1st and it will close at the end of the month, so April 30th, 2022. The applicants will be required to complete an online application at www.hsa.ky. And that application includes an essay as to why they should be selected for the program. And we also want to emphasize the areas where more Caymanians are needed as well, because they're the administrative and the support areas, since students often tend to think about mainly clinical positions when they hear the word healthcare. But there are also administrative roles, like I mentioned earlier, the HR, support areas like IT. We have biomedical engineers to help fix our machines in order to save lives, IT technicians to help to prevent patient fraud and identity thefts, accountants to keep checks on our finances. So there are so many different positions that we need filled, especially need Caymanians to fill.
And now's a good time to actually start because, we're coming out of that COVID situation and everybody's been kind of in a bubble. And now it's time to, you've been thinking about, well, what am I going to, because I tell you, with a teenager, you hear, I don't know what I'm going to do. I don't know. Well, this is something for you to do. This is a way for you to start connecting with people, connecting with the job atmosphere, and start helping at least lay the groundwork for future endeavors.
Do you know what I think is important as well? Sometimes when we are as a part of the community and we see work happening, we don't understand what happens in the back end. And when you mentioned COVID, that came to my mind because joining HSA as the front runners for managing COVID-19 in our community will really give our students some insight into, what we need to do and what kind of resilience we required from our staff to be able to really manage this thing, island-wide. It's going to give them some perspective, even the things that we now still have to do. And that, as one of the added requirements when you apply, we really are going to need our students to be vaccinated, of course, because we want to keep them safe, but we have to also consider, our patients. We have to keep our staff healthy so they can continue to look after persons. We're going to want to ensure that they are doing their weekly lateral flow tests. We do those multiple times a week as staff, and we'll expect our students to follow suit because we want you to continue to be well. So even in this environment, students might think, oh, I don't want to go there. It's healthcare and I'm scared. We actually have provisions in place right now for how we're keeping our staff safe, and we'll do exactly the same to keep students safe. So parents who are listening and thinking, I want my child to do an internship, but I'm fearful of them being in this environment. We're definitely going to ensure that we continue to have those safety parameters in place to ensure that, like I said, our patients, our staff, our service users, your students, your young persons, your children are safe if they decide to come to internship with us.
And that's the beauty of it. We have an organization, the HSA, that's by all accounts a very world-class facility. I must commend you over the years. I've watched it just perform and perform undauntedly. I go there and I've never once had a bad experience or ran into somebody who wasn't able to help me at that time, find out what I needed. And sometimes it wasn't even the doctor. Sometimes it was just information. Well, I have somebody who needs to come in. How do I call on the phone? One of the things I always say, you can judge an organization by its first tier of administration. And your first tier of administration has been awesome. And if these young kids can learn from that, that would be a great experience.
Absolutely. And that's what we're hoping. We're hoping to model some of these interactions, these workplace interactions with our service users and with our colleagues, right? Because whether they decide to come work with us or they go elsewhere, you're always going to have colleague interactions. You're always going to have differences of opinions, different characteristics. Like I said, the size of our organization, you'll definitely learn, multidisciplinary working and interdisciplinary working, because you'll have to communicate information with other departments. And when you don't complete your task, does that stop someone else from being able to get theirs? Or do you need to do something so that someone else has the information to work with? And so there'll be a lot of, even networking, like you have an interest in one field. And let's say you get placed somewhere that you don't like. And that's one of the things that students will say, hey, you know what? They only had this place left and I didn't get to. But we work so much together as a team that you will still have the opportunity to engage with others. You'll set yourself up for a situation where you can come back next summer and you'll be networking with the professionals in the field. And if you really make your best effort and you have you leave a positive image or a positive mark on the organization, then you'll hear your name still ringing through our corridors when you leave going, hey, you know what? Such and such was such a wonderful student. They took so much initiative. So if you want to get into healthcare and let's say you are going to go off to school and come back, get your name out there.
Exactly. And folks, as we keep talking, it's just more than just one avenue that we're talking about here. They gave examples for IT. They gave examples for biomed techs, which is one of the, if you like me, I'm a very computer person. I had to look that up, and they make a good living.
Oh, yeah.
Yeah, they make a very good living. So these are avenues. So you don't have to be one-sided. Maybe you're a gentleman that's very good with your hands, or a female that's very good with your hands, and you like putting things together, drawing things and things of that nature. This is an avenue for you to find out what you really like more than anything. Because maybe the first week they say, hey, I didn't really like the accounting department. Can you shift me to so-and-so? I have a friend who's talking about this. So you get to some real world experience. Tell us a little bit about that. I mean, learning in the classroom is one thing, but now we're coming out of the classroom. We're entering a real life situation here.
Yeah, so as you say, learning in the classroom or in like a student laboratory is one thing, but learning on the job is another thing. So during your internship, you may have the opportunity to work with actual patients or work in an actual forensics lab, or on the facilities team with the actual grounds persons. You'll basically be truly using your skills in the workplace. And what's more, you'll be under the direction of a supervisor who can help you if you're, for example, nervous or unsure. So in this way, the internship is a great way to take that first step into the career field of your choice.
So it makes it almost 100% because you're changing the dynamics. You're going to have people who this is what they do for a living. This is them telling you. It's not somebody who's, and I love my teachers and I'm not taking away from you, but this is outside of a textbook. We're exposing to almost like a sample workplace, but it's a control sample workplace because you're with professionals.
Yeah.
At HSA, we have so many roles, so many departments, so many professions, but all are respected. And I know sometimes when we have career paths that are more trade-based career paths, and I'm talking about your plumbers, your electricians, your AC technicians, all those persons, sometimes, we don't find our students wanting to go into that as much. We hear everyone going, yep, I'm going to go off to college and I'm going to go off to university and do all these other things, which of course we need all of them as well, but we need our tradesmen. And so the organization offers an opportunity for these types of positions as well. Because we are so large, so vast, and actually one of the largest employers in Cayman, we have to have all of these personnel as part of the team. So we don't have to outsource as much of our services because sometimes we just need it now, right? In healthcare, when something breaks or when something goes wrong, we need it sorted like this, right? And so those are all positions that we have. Those are all staff that we currently have. And so if that's an area of interest, HSA is still for you. And that, I think that's the point that I'm trying to drive home here is if you can think it up, we probably have it.
Yeah, it's a well-oiled machine, but that machine has a lot of different parts. I mean, you guys, I'll just toss this out there. You have plenty of healthcare. You got the small med offices, you have specialty office, you got outpatient centers, wards, plus you have the hospitals and different islands. Yeah. So there's a lot of entities that people need to do.
Yeah, and students can do placements in Faith Hospital. We have our district clinics. We have so many departments. And I like that you use well-oiled machine because when you have a machine, all the parts are important, right? Because they all do a job. And I think when we think of some of these careers that persons aren't so, and I'm not going to say aren't so willing to, but if we find our young people aren't running towards, they're all vital to us. We respect every single member of staff because we realize that they all make a valid contribution, and that contribution is going to be important and relevant to the overall running of the organization. And I'm going to use HVAC tech, which is our AC technician, for an example. If our AC technician didn't exist, didn't come to work, we didn't employ him, and the AC broke down, we would have to then call all the companies, hope they had some time to come down to work on this for us. And beyond just being really, really hot inside a really enclosed building, things like infection control start to come into play and all these different things. And
the outside organization hasn't been prepared to deal with those ideas.
Yeah.
And it's so funny that is probably the simplicity of what you just said. Something as simple as air.
Yeah.
That is paramount to having a decent, because I know here in this radio station, when it cuts down and we can't get them for XYZ, people are, but in a healthcare setting, I can't even imagine that.
Yeah. We just want to call your extension and have you take 2 minutes to walk from where you are to up to where we are, right? We don't want to call you and you give us an appointment for next week. And so we want our young people to come and take up these jobs and do these things for us so that our organization can continue to run in the example that you gave, like a well-oiled machine, right? So that's why we need you. And I'm really pushing for all the parents listening, all the students listening. Send in your applications. Today is the day. It's open. Very exciting time.
Once again, now that you brought that up, what's the website that they need to go to get the information?
It's www.hsa.ky.
And when you go on there, folks, don't forget there's an essay that you need to submit along with that. That is paramount because that gives them a more of a well-rounded look at you. And as you said, it's hundreds of jobs that are available for our young citizens here. And all you have to do is send it in. That's the first step. Do that, and then placement comes afterward.
Yes.
Makes it very, very simple. And so we're talking about placement. You get to practice with a certified professional. We were talking with a lady here from HSA who had been there. She said she'd been there 30 years. And I'm just like, that is a wealth of knowledge. I wish I could work along with somebody who has been in there in any industry for 30 years because the wealth of knowledge that you possess.
Yeah,
it is. And so that's one of the advice that we give to interns as well. You try to learn as much as you can while you're there. Learn about how the facility works, learn what protocols you need to follow, what job skills you need to improve on, how to interact successfully with patients, bedside manner, how to communicate effectively with your coworkers, and your superiors. Just take time out to ask others how they got their start, where they found their first job, and what advice they would have for you. Ask them to tell you how you're doing and what suggestions they would have for you to improve. If you look at your internship as an opportunity to learn from others, you basically can gain that guidance that can help to start your career off on the right foot.
And I'll just toss it out there. So suppose they've never had a job before. You walk through how decorum is always paramount. Tell me a little bit about that. You walk them through what a professional behavior is. Tell me about that.
So one of the things that we do is we create we've created a student handbook. And so it is, and in addition to the handbook, it's not just, we don't just give you the book, but we have a student orientation. And as part of the orientation, we tell you and give you information about the organization, the expectations. When you go to your department, then you'll get a department orientation where they show you where everything is. We explain things like the emergency codes. Where do you go if there's a fire, and assembly points and emergency numbers, and all of the important things for everyone to know, whether you're staff, volunteer, student. And then we give you your handbook that you can refer back to that has things like your dress code and your times and your, what departments where and what's important for you to know. So we really do our best effort to help persons to transition or students to transition into doing placement with us, because we understand that this very well is your first experience ever. You don't know what it's like to be in a working world, and you don't know what people expect of you and what you should expect of others. And so we want to give you as much information as we can for you to feel comfortable and feel like you understand without it being overwhelming. So we do take the time to transition you into your placement. It's not like you're going to turn up on day one and we go, okay, you're in this department, have fun, right? We really will take you through a settling in process, so to speak. So we do have a formal orientation that you'll go through. You'll participate in some relevant training. You'll have your reference material that you can refer back to, and you'll get to meet your manager, who's the person who you can ask questions and get support from and directives and all those things. So
there's an opportunity here for mentorship and advice also.
Absolutely.
Is what you're saying.
Always. Yeah.
And that's the thing I think that means so much in this day and age. People kind of just toss you into things. Yeah. It's like, they just think the internet can tell you everything. They're like, okay, you can YouTube it, Google it, you see how it's done.
Yeah.
You need that personable experience. You need that mentorship program, basically, in a nutshell. Tell me a little bit about how you guys go about that with the internship program.
With the internship program, so on your day one is when you would go into your orientation. And so we'll give you a general orientation that will be about the organization and the general expectations. And then once you get taken to and settled into your unit, whomever you're assigned to will go ahead and give you a unit orientation. And because, like I said, we have so many different departments, what you will need to know or be shown in one department will vary from what you'll need to know and be shown in another department. One of the things that that the managers do as well is I will already know what someone who is going to pharmacy or dietary or someone is going to be doing, because they'll tell me the list of responsibilities. I'm going to have this person, sort the shelves, or I'm going to have this person do data input, or I'm going to have this person, count and package or label medications, or whatever the responsibilities are. The managers have already predetermined that. And so we have our evaluation form at the end where we can say, these are the tasks that we've given you to do. This is how you've been doing. This is how you're continuing. This is how you can improve on it. And having those discussions so someone doesn't leave and feel like, I don't actually know how I did, right? So, and then you'll get the opportunity as students to give us feedback as well. So there's going to be a form, survey. Yeah, that they fill out at the end.
They get to fill it.
They get to survey us and let us know how we were as an organization, as a placement organization.
Because
then that feedback contributes to the next year's orientation, right? Or the next year's student internship. Their perspective is going to be important.
That's a real progressive way of doing things. A lot of organizations don't do that, especially in an internship. So kudos to you for taking that on. I mean, it's an opportunity, I guess, to learn from others and be guided to start your future career off on the right foot?
And we have a number of staff currently who started off as student interns. Actually, I was hoping to, and unfortunately, due to busy schedules, I was hoping to bring one along. And he was saying to me, no, my shift today is really, really good. And then he actually stopped and he said, actually, I've been here so long, I don't ever remember what year I did the internship. You know what I mean? And so long-standing employment does follow a lot of our interns. They come back the next year for the internship again. And sometimes when the jobs become available, they apply for it. You know, if it's a fit, they're successful. And they go on to have very long, very successful careers with the HSA.
Excellent.
And another thing just to note is this internship offers you that opportunity to try something and see if you, for example, maybe you've been placed in lab and you find out, oh, well, lab isn't what I expected. And I definitely don't want to be a lab technician. I'll try something else more. Maybe I want to work more with patients. I want to be face to face with people at the registration counter. So you kind of get an idea of what it is that you actually enjoy being placed in the actual role and what it is that you don't. And you could just try the next time and try and ask for to be placed in a different department.
Yeah, I agree with that.
And that's still internal networking.
Yeah.
The beauty of that is you're networking with professionals, possibly for a future career. Because as you said, the gentleman, he didn't think he was going to be there, but he continued there onward.
Yeah. Absolutely.
In job searching and networking, tell me a little bit about that. I mean, you have so many different career paths and career opportunities. Sounds good. Once again, folks, you're listening to Healthcare Today with the HSA, the Cayman Islands Authority on all things health. Each and every Friday and Saturday, we get together and sit down and have an honest and truthful conversation between the hours of 1 to 2 p.m. right here on Bobo 89.1 FM.
Keeping you up to date with information you can use. Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Bobo 89.1 FM's your community station.
You're listening to Healthcare Today with the HSA, the Cayman Islands Authority on all things health. Each and every Friday and Saturday, we get together and sit down and have an honest and truthful conversation between the hours of 1 to 2 p.m. right here on Bobo 89.1 FM. Tell me a little bit about the networking situation here.
So with networking, the first thing is like I said, there are a lot of departments. We work together as one team, and so you will have to engage and communicate with any of the other departments that are relevant to the one that you currently work with. So that's the first thing. The second thing is it's just important to know for students that when you are in a career field that you have to consider networking as you begin your job search. Networking is something that you should do to develop and, maintain your entire career throughout your entire career. So not just as an intern, but just in general, in general, right? Your internship will give you the opportunity to meet who you are currently working with in the field that you may want to enter. So if healthcare is the field you want to enter, you will have first-hand opportunity to meet the managers, meet the staff, meet the people on the ground in that actual field. I don't think it gets more firsthand than that. It's almost like saying, I'm going to an interview, but I want to meet all the people first. This is what that is like. It's like meeting all the people before the interview. So it's a great opportunity,
the door is
right?
open.
Yeah.
Wide open. You get to know them by name. And like I said, if you make a good impression, then they get to know you by name as well. And we do remember our really top students because we're saying, hey, you know what? I had little John in my, my unit and he was excellent. Or I had little Jenny in my unit and she was great. And even next time round when internships come around, you'll find some managers even looking for, those star students. Yeah. Because they're excited to hear that they're coming again, right? And they do make valid contributions to the respective units that we have. So I I'm hoping that even if persons are feeling shy, apprehensive, concerned, call us and ask us more questions. I mean, you're hearing us on the radio, and I'm hoping that this is getting you excited. But if you still have questions, call us and reach out to us. Like you need to know that the organization you're coming to is approachable and that you can give us
So if speaking on that, if they wanted to call you guys to get some more information, is there a number that they can reach out to?
I mean, they can call the main number, which is
949-8600.
Okay.
Right? Your applications would be coming through to the HR department. So if you want, you can ask to come through the HR department. But if there's another section that's more specific where you said, I actually am interested in this department, I have some more questions, then think about and even write down the questions that you might have. Because if you call HR and we say, so you'll say, does lab do ABC? Or, can these subjects that I selected in my last year of school, get me into this career? And if we don't have the answer, then we'll call that section manager and ask them. We'll call you back. So if you have questions or you're unsure, get your parents to give us a call or give us a call yourself, depending obviously on the age, and let us help you make that decision about this being a fit for you.
This sounds positive. This is a direct link to a person.
Yeah.
This is the first step of them saying, hey, when I send this into HSA, this is an opportunity for me to start building towards, if you're planning a tertiary education, if you're looking just to continue on and get into the work field, these are steps that you have to do no matter where you are. But you guys are giving it away as an internship.
Yeah, absolutely. No, and not just giving it away, but paying you to do it.
Oh, they get paid for this?
Oh, yes, they do.
No.
Absolutely.
I'm
mentioned that at the beginning.
I'm kind of
No, we
older.
mentioned that at the end because I want them interested. I want the genuine interest first, and then this is the icing on the cake, right?
Because I'm like, it's an internship. Y'all giving, and now you're paying. I'm kind of old for the program, but to be honest with you, all jokes aside, I think that is a plus no matter where it is.
Absolutely.
The learning is immensely, tremendously beyond, and now you're going to give them a few dollars on top of it.
Absolutely.
So folks, you guys got to take advantage of this. I've traveled the world, and I've never heard of an internship on this level getting paid. Kudos to the HSA for doing this, and take advantage of it. Let me just quickly before we wrap up in just a little bit, let me go back and talk just a tad bit about the internship, the acceptance program. So I know we said that it's been running for a couple of years. So if I wanted to get involved into it, if I'm a student and we ask that you be, again, Caymanian. Tell me a little bit about that before we wrap up here.
All right. So our Caymanian students or students with right to be Caymanian is the first prerequisite. We are also going to want to ensure that you are at least 16 years of age. So that's the minimum age that we accept is 16. We need to ensure that just currently, because of the ongoing persistent COVID pandemic, we have to ensure that you are vaccinated and fully vaccinated, meaning at least the first 2 doses. Mm-hmm. You can choose to or not to have had the booster, but definitely the full 2 doses. And this is to ensure, the student safety, the safety of our patients and of our staff. Mm-hmm. We definitely want to ensure that you have a genuine interest in healthcare. And I think that's why I mentioned the pay right at the end, because we want our students to be coming to us because they want to gain something as it relates to knowledge, experience, right, and understanding of healthcare. And when I say healthcare, again, I'm talking about our clinical and our non-clinical sections. We have to ensure that you've completely filled out the application form. And again, you can find that at www.hsa.ky and ensure that you do your personal statement. That's going to be important as well, right? So it's like a mini essay. And you really want to be able to identify, what time you're available in terms of, even though we're starting between June and September, someone might not be available till July or, and depending on how many students we have, we might give you shorter set of time so we can stagger the students to come in as the summer progresses. Mm-hmm. So all those things will be taken into consideration. But definitely know that this is your area of interest. If you're Caymanian, if you're 16 and over and in full-time education, then go on our website, read up more about it, fill out the form, do your essay, and send it in. We'll definitely get in contact with you and get started on the selection process.
Awesome. And folks, this is available right now until the end of April. April 30th is the cutoff date. So, but don't wait till the 29th. I know sometimes you'll procrastinate. Get it done earlier, which means that they have more time to fit you in, because you don't want to be rushing and be like, okay, well, I really wanted to be in the biotech, but I only got to this.
That's true.
Or maybe you want to be in data and you say, okay, well, the only thing that we have left is front, So you have to get there early. When you're doing the application, put in as much information about yourself, because that you're the marketable one.
Yeah,
and that's the idea of it.
And if a student identifies an area that they want to be in, or even identify a general interest but don't know the area, because they won't know all of our sections, right? We've got more than 52 sections at the HSA department. When I say sections, I mean departments.
Departments, right?
So you may not know, and if you even express your interest, so we'll have someone who says, I'm interested in food, and we'll say, hey, great, we have a nutritionist, we have a dietitian, and we have a dietary department, right? Someone has to cook and feed the staff. Mm-hmm. Right, so even if you want to be a chef, we have placements for you.
See,
right?
I never even thought of that.
And I think there's also a list that's included in the application. There's a list.
The list is so short though, because
exactly.
we can't put them all in there.
I think there is a list, but then there's the other section that says other, where you could just specify what exactly it is that you're interested in.
So if you don't see it on there, don't worry, we probably have it, right? So please send your applications in, whether you see a section that you're interested in or not. It's just because we couldn't fit it all in there. EMS has been big booming right now, or paramedics, persons want to get into, being on the ambulance department.
The more you keep talking, the more different departments I'm hearing. And I'm like, EMS, I totally forgot about that.
Do you know what? Even we have a materials management department, and someone would think, what is that? Like, we have a warehouse. We literally have the people who stock, order, bringing everything that we need, from our medical equipment to our pens. And so even that, someone who might like to work with their hands but don't quite know, right? Mm-hmm. Then there's still something for them. We obviously have our facilities. So if you're into construction or, electrical or plumbing or any of those, landscaping, exactly, you're into that. So I'm telling you, if you think of it, we've probably got it.
The list is long, which means that just means it's more opportunities.
Definitely.
There's more opportunities for our young Caymanians here to kind of get an idea of a chosen field, because everything is part of something else.
Yes.
And that's the beauty of it. If I was just to go to, and I'm just using this as an arbitrarily company, if I was going to go to an accounting firm, it's accounting.
Yeah.
That's what they do.
Yeah.
When you come to a radio station, it's broadcasting. Now, mind you, there's several tiers of it, but it's not 900 workers, and it's not 52 tiers in an office like that. Yeah. There's a few, but definitely you guys are expansive. And that just means that now we have young people who can actually have a longevity of a career to start off with.
Even within our departments, or subsections within a department sometimes can be so vast. You mentioned finance. Mm-hmm. So we have our core finance department that's like accounts payable, right? Mm-hmm. We have payroll, because someone has to pay the staff. Then we have what we call procurement. So these are the people who actually go and compare the prices and the products and the quality and create the contracts if we have to have a contract with a company, right? So even besides actually crunching the numbers and saying, let's pay this bill, there's actually a department that does all the preface before we even get to that stage to do the legwork in, is this better value for money versus this? And who do we go with?
That's perfect for somebody who, like me, I love shopping, and I try to find the best deals for the best product.
Exactly
and
that.
So I'd be like,
what can you do?
Yeah, exactly.
So if you put on your form, I like to shop, we'll put you in procurement, right? Then once the things come in, we have to make sure someone takes stock on it and look at the quality of it and deliver it to the respective units, and store it properly if you're not using it straight away. So then our materials department is a part of that. So when we think finance, and then we have our patient financial services, which are the ones who aren't dealing with our internal finances as it relates to paying the staff and purchasing the products. But they then go and collect the bills and the insurance from the service users, right? And then our coding department will say, you came here and we're going to drop this medical code, which then goes on your bill. So it becomes so extensive, even within one department or one area. Oh yeah, right. It's there is so. I keep saying, I have never, like you said, been in one organization that had so many different career paths, so many different organizations under, and I'm going to say one roof as a metaphor because we have many roofs. We've spread out across, we've spread out across the island at this point.
Islands.
Yeah.
And I'll tell you, from a person like me who I'm on the outside looking in, and you ladies are enthusiastic about it.
Sure.
That alone makes me happy and want to get involved, because you can't tell me about a product and make it sound appealing and happy unless you feel so too. And that's at the core of it. I see the dedication and the passion towards that company based on just having a conversation with you, which means that it's like, wow, I should be that passionate about something. And this is an opportunity for young people to be that passionate about it.
And let's hope they see our passion when they come to us, right?
Yeah.
Exactly.
I mean, healthcare is a very rewarding field. It doesn't matter which department you're working in, like working in the marketing and comms department. Like, I feel like I'm directly contributing to the lives of people by just in my role. I'm not working with patients directly, but I still feel that connection to the people I serve, to serving the people of the Cayman Islands. So I think that's one of the things that drives my passion to work in this at HSA. Just I feel, especially in this time, COVID time, working in healthcare, you feel so proud to be a part of this industry.
As we get closer to wrapping up, let me just ask. So I come through the program, I did really well, and now say I want to go off to university, and I come and I say, hey guys, there's a company that the school deals with. Is it possible that I can get a reference from you guys? Is that possible?
You will have your feedback form. So, of course, with anything that we do, we have to keep a record of it. So if there's anything that hadn't been shared with you in your review, then yes, you can absolutely ask for that. And we'll have our students do that, because I'm going back to university, or I'm just about to graduate, and someone's just expressed interest. I mean, in the same way that we're giving you the experience to be able to put on that resume, then we very well, we'll need to confirm that if that's required.
And see, and that's one of the things, because a lot of schools nowadays, and it's so funny, and I'm talking universities, not high, a lot of universities actually ask, do you have any other experience in this?
Yeah.
So for me to put down, hey, I was working with the health services of the Cayman Islands, that alone is a lot of understanding and of the knowledge of the business.
It carries a lot of weight when they come back to work with us too, because sometimes a student may not come directly back to us, but later on they may see a job advertised and apply for it. And there's so many times that I've actually seen it on a resume. A few years back, I was an intern with the HSA. And so even if it's not right out of high school or right out of university that they apply with us, sometimes a few years later they apply with us, and then you still see it on a resume, which for us makes us proud, because, it meant enough and carried enough weight for them that they would keep that there to say, hey, you know what, I was with HSA.
And wrapping up, anything you want to say in conclusion?
Just to apply as soon as possible, because I do believe, and Raquel can confirm this, that it is a very competitive internship.
Very competitive.
We do have limited amount of space.
We do.
So we just encourage you to be one of the first to apply.
Absolutely. Like I said, last year we had to take half the amount of students we typically would take, because obviously COVID was and still is rampant in our community, and we have to make sure that we're managing the population within the organization in terms of traffic in and out. So if it comes to that this year, where we have to be mindful of the amount of students that the managers can take on, because again, they may be managing still the COVID pandemic in addition to whatever their department would typically do. And so they may not have the ability or capacity to take on as many students as they used to, as well as us having to make the environment safe. So get those applications in as soon as you can. It's really imperative in securing a spot. And I know a lot of persons are disappointed at the end of not being able to be placed, but we will make our best effort to place as many persons as we can. So we don't want you to give up and say, hey, you know what, they don't have a lot of spaces, I want to apply. Get those applications in. It is very competitive, but if you've met the prerequisite and you get that application in early, you should be just fine. Today's the day. It's open today. Go today and check it out, right? www.hsa.ky. Fill that application out.
Sounds good. Once again, folks, you're listening to Healthcare Today with the HSA, the Cayman Islands Authority on all things health. Each and every Friday and Saturday, we get together and sit down and have an honest and truthful conversation between the hours of 1 to 2 p.m. right here on Bobo 89.1 FM. So keep it right here. I want to say you're the host and I'm the guest because you girls have done, Miss Monique and, of course, Miss Raquel, you ladies have taught me a lot and made me wish I was a teenager so I could
apply.
So I could apply for the program because this is a world-class facility and it's basically offering you a first-tier step into the world of business, the world of education, and also a professional step. Thank you so much, ladies. I look forward to having a conversation with you again. And folks, as a reminder, go today online at www.hsa.ky. Registration is closing at the end of the month. You want to go ahead and do it early like today. Thank you so much for tuning in. Any parting words you would like to say?
So between June and September is where we'll offer placements. Some, like we said, university level placements will extend across the entire time period. Some persons will be offered some earlier dates. Some persons will be offered some later dates within that time frame between June and September 2022. Very exciting.
So we're very excited to work with you guys.
My pleasure. Once again, folks, this is Bobo 89.1. Keep it right here. We'll be back soon.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
You're listening to Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Keeping you up to date with information you can use. Bobo 89.1 FM.